Hello, welcome everyone. My name is Courtney Rinkevich, and I am so happy to welcome you to our 7th annual Cannabis in Practice webinar series. This is hosted by Washtenaw County Health Department and the Livingston County Health Department in partnership with the Washtenaw County Medical Society. This webinar series is aimed at addressing questions our local and regional healthcare providers have about cannabis use and their patients. And our speakers come from a variety of backgrounds and are experts in their respective fields. Funding for this series comes from the Michigan Department of Licensing and Regulatory Affairs Cannabis Regulatory Agency. To review some housekeeping notes before we get started, all participants are muted throughout the session, so we ask if you have a question to please use the Q&A box to submit those questions. And we will save some time at the end of the presentation to try to answer those questions for you. If you require a live transcription, select the Show Captions function at the bottom of your screen. If you don't see it, please resize your window to be a bit wider, and the feature should show up at the bottom of your screen. This webinar is also being recorded. The recording and presentation slides will be available on our website, washtenaw.org/marijuana, in the coming weeks. This live webinar has been approved for 1 credit hour of social work continuing education, McBAP credit, CHES credit, Mishwa credit, and CME credit. If you're requesting any of these continuing education credits, please be sure to stay until the end of our presentation today to fill out the post-webinar evaluation survey. And for disclosures today, none of our planners or speakers for this educational event have any relevant financial relationships with ineligible companies to disclose. Now I am pleased to introduce today's speaker, Dr. Crystal Collier. So Dr. Collier is a therapist, prevention researcher, and educator, named Counselor of the Year by the Houston Association of Counselors. She specializes in empowering parents to protect children's developing brains. She is author of the Neuro Whereabouts Parent Guide and Know Your Neuro Adventures of a Growing Brain children's book series. In her free online prevention website, www.knowyourneuro.org, she teaches the neurodevelopmental effects of 18 different high-risk behaviors, prevention strategies, and brain-based parenting techniques. With that, I will turn it over to our guest, Dr. Collier.
Oh, thank you, Courtney. I appreciate that. Okay, let me get this started from the beginning. Okay, if the screen is not showing up, I trust that you guys will let me know.
Yep, it looks great.
Oh, fantastic. Good, good, good. Okay, so I'm going to go ahead and start with just a little bit of information about me. So these are pictures of me when I was growing up, not my brain scans, but to the backdrop of that. So when I was 18, I went to rehab, and I've been in recovery since February 3rd, 1989. I had a lot of genetics and family stuff happen as I was growing up, and I started using alcohol when I was about 12, intravenous substances by the time I was 16. I look at that 16-year-old picture right there, and I can't imagine all the things I was doing, but I was always also straight A kid and a rule-following kid. The juxtaposition of that blows my mind. But when I got into recovery, all the shame and all the feelings that had hit me about what had happened in my family and what was going on were very overwhelming. And so I started really pouring my brain into learning about addiction. And I have been studying it ever since. These really cool brain studies started to be published back in the late 90s. So when I became a therapist in 1999, I had already had a lot of experience working with people who had addiction as a tech in psych hospitals, as well as mental health issues, and learned a lot about it as I was going. So I am a therapist. I see about 15 to 20 clients per week, but I also have a prevention program that is free, knowyourneuro.org. Please feel free to use the resources there. I created videos for kids from kindergarten through 12th grade, a parent page, lots of resources for schools and clinicians. Now, what we're going to talk about today is very specifically cannabis, but I study how all kinds of high risk behavior affect the brain as it's growing. And so a lot of times I think about that all of these are preventable pediatric onset illnesses. And if you think about it in that way, I think it creates a paradigm shift, right? It's not just a bad decision. It is a preventable pediatric onset illness. Mental health issues as well as substance use issues. 90% of adults who grow up and get diagnosed with a substance use disorder began using when they were teens, but 90% of adults who grow up and get a mental health disorder actually began experiencing symptoms when they were kids or teens. So it's very important to realize that this is a fragile period of time, and early substance use initiated even before age 15 increases your risk of addiction so incredibly intensely. But as you can see, this beautiful chart going down the graph, just delaying substance use has a protective effect on our brain and the rest of our lives. So the longer we delay, even if we have a genetic predisposition, the better our chances are of staving off any type of an addiction issue. It's also important to see that we have our job cut out for us if we work with kids, because the onset of almost every single major mental health issue is either elementary, middle, or high school, as you can see in this graph. So we need to make sure that we start treating these issues early. But most adults who grow up with a mental health issue don't actually receive treatment until their late 20s or early 30s, which is so scary to me, because they could have been treating it for so much longer had they been able to ask for help or get diagnosed. So here's what I did. I started researching these 18 high risk behavior because I wanted to see, okay, how do they affect the brain? How they affect the brain differently? What do we need to do about it? And then I thought, oh my gosh, I'm going to put them in a book in accordance to what age they spike. So the Neuro Whereabouts Guide is my parent guide that has information about all these in order of when they start. So there's an elementary, middle, and high school chapter that shows when these go up, what you need to say to kids and clients about this and how it affects the brain, and then a checklist for what to do. So really, really easy. It's infographically styled, easy to learn and understand. It's also a really great clinical guide that helps with empowering parents and clinicians to have the right information at the right time. Now, I want to introduce you to my superhero. Here's Neuro. And so the idea is we want kids to fall in love with their brain so they will protect it. And so my children's book series comes in two forms, K through 2 and then grades 3 through 5. Grades 3 through 5, and when we start to mention 7 of those high-risk behavior. So prior to that, we're talking about the brain and executive functioning skills. So 5 out of 10 books are out. Those are all available on Amazon. But I'm going to share with you how I think we should teach kids about brain development the way that I do in the kids book series and in the parent book. And just so you know, too, I actually have a here's the mock-up copy for the teen guide. So I've got a book coming out that's written by young people for young people who've been helping me do that over the past 3 years, putting the parent information into a teen-friendly speak with new research. Okay, number 1. What we need to be able to do is to teach kids about their brain development. And here's what I make sure to let families and kids know is that we have 2 main phases of brain development: birth to puberty puberty to around 25. So that first chunk of time is when we grow 200 billion neurons that completely develop by the time we're in puberty. So it's almost like we get this big chunk of clay in our brain, right? We have all of these neurons we're born with, and then they start to develop and really thicken and grow up to puberty. Then when puberty kicks in, our brain goes through changes too. We don't notice it as much because we see the mood, we see the physical characteristics, but what's happening in the brain is critical because we're losing neurons. By the time we finish this stage of brain development, we have half of them left over. But we have this beautiful, well-connected, sculpted brain that we were able to create with that big chunk. Now, here is what literally is happening. So this is a neuron, a little baby infant neuron. And you can see the cell body, that dark spot there, and then straight north from that is the axon. And what you see on the sides and on the bottoms kind of look like tree branches and tree roots. Those are dendrites, my absolute favorite brain structure, because dendrites are the hardware of learning. So every time you learn something new or you practice something, your brain grows dendrites that reach out to other cells, making long chains of networks in your brain for that skill. So what you're seeing is those little baby neurons over there on the left growing all the way up to age 2, just 2. Can you imagine what these look like when you're 25, when you're 65? Okay, we grow dendrites for the rest of our lives, but how flexible and plastic and movable they are peaks at the age of 25. And how fast we think and learn peaks at the age of 25. Our learning speed, thinking speed, all slows down from 25 on. So we want to protect all of these neuronal pathways, but we also want to grow them. And so what do all those pathways do? Well, in that second phase of brain development, they are growing our prefrontal cortex. Now, it's been growing since we were little, but it's very underdeveloped when we're, as you can see in this picture, 5 all the way up to 8. We have one, it's just primitive. We're concrete thinkers. We are focusing on the 5 senses and just playing and being kids. Then we get to puberty around age 11, 12, and you can see the thickening is starting to happen. So the darker the color, the less gray matter. This is when we're starting to prune away cells, but we're growing white matter, which are those connectors, the dendrites. So you can see by the time we're 12, we've got about 10 to 15% of our frontal lobe. And then by 16, we have 45%, which is wild because we give them a license to drive with half of a brain. Always scary. Why our insurance rates are so high. But then we get to age 20 and we have this really thick, well-connected prefrontal cortex full of dendrites, but much less cells than we had before. So our brain needs room to grow dendrites. So it gets rid of cells so that we can connect the dendrites that we need. Now, what do we need? These are the things that we need. Our executive functioning skills. That is what our prefrontal cortex or our frontal lobes do for us. And here is how they grow. The first ones, basic executive functioning skills, come online in elementary and middle school. These are the ones that we need to get up in the morning, out the door, remembering our homework, motivated to do things on our own. So I want you to think of task initiation as motivation, right? We just do things without having to be asked. That is that. Then, as we move into puberty and we start to grow our higher level executive functioning skills, these are the ones that we need to get up and out of our parents' house, become fully self-supporting. These higher level executive functioning skills really help us become the adult with a healthy relational personality that can do and tackle a lot of problems and a lot of life situations. The number one best predictor of adult success is in this list: impulse control. So, impulse control, emotion regulation, frustration tolerance, the ability to feel empathy, these are all really important EF skills that grow based upon the brain's rule. The brain's rule is use it or lose it. So, the reason that we get rid of neurons during that second phase of brain development is because we need to make room for the skills we are using and the connectors for those skills. So, if you are, let's say, an over functioning parent and you solve all your kids' problems and make all their decisions, they're not going to grow long networks of neurons for that. They're going to grow long networks of neurons for dependency on you to solve their problems. This is something I hear a lot in therapy of parents who have kids that are not very motivated to solve their own problems and make their own decisions because they may have been over functioning. And now they don't know how to get kids motivated in that way. And the idea of natural consequences can be too scary for them. So we have a conundrum we have to work through. Okay. Now, when I teach this to the littles, of course, I use Neuro, your superhero, and really make it fun for kids in the kids book series. But this is what we want to do. We want to make sure that we teach kids what executive functioning skills are, how they grow and develop, the brain's rule, use it or lose it. So your battle cry as a parent or even a clinician should be dendrites, 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 because those grow based upon what we use. Okay. Now, let's talk about attachment. Now, I'm not necessarily talking about the attachment to humans, although it's the same exact process. So, we have four things that make us happy in the world, pretty much, and here they are. So, when we are in pain, our body produces endorphins to relieve us of that pain and to also make us feel good and better when we're sad or we're down, exercising, laughing, listening to music. When we need to regulate our mood or our body produces serotonin. When you need to connect to humans, people that we trust to keep us safe, oxytocin connects us to that. It also connects to people who we need to help make feel safe or our animals. But what we're going to talk about primarily is dopamine, which is the reward chemical, right? You guys know that when you do something good for survival, your brain gives you an increase of dopamine in your beautiful limbic system here. Now, when you think about dopamine's pathway, I want you to understand that it goes through the limbic system and into the frontal lobe. So, when you're little and you see this woman walk in with food, you're like, oh my God, she is so good for our survival. Of course, you're not consciously thinking this, but your limbic system is reacting. It's basically increasing dopamine when that happens. And so our limbic system says, ooh, whenever she shows up, we should increase dopamine levels. So you should remember this. But then there's another step in the reward pathway. The limbic system sends a signal to the frontal lobe that says, wow, whenever she's here, we get warm and fed and we're happy. So we should attach to her. And that's why the limbic system sends a signal to the frontal lobe that says, you should really love this person and feel all warm and fuzzy when this person shows up. And then that happens. The frontal lobe says, check, we are attached. And now we will remember this. And whenever she comes in, we'll start this whole pathway. This is the same pathway that drugs of abuse or addictive behaviors take. Right through our beautiful ventral tegmental area, the nucleus accumbens, and into our prefrontal cortex. It is exactly what happens when we attach to people, places, and things. You can see this happening in this little baby's brain and also for the adult. Now, when we think about dopamine getting hijacked, I want you to think about this chart. This is a very old study from NIDA that looked at different behaviors and how much they spike dopamine. That found when we haven't eaten for 7, 8, 9, 10 hours, our dopamine levels plummet. And as soon as we eat, our dopamine levels go up by about 100%. So first of all, your limbic system is like, dude, you need to go do something good for your survival, or you're going to feel pretty miserable for a while because we're going to decrease your dopamine levels. As soon as you eat, your limbic system increases the dopamine levels in your system, and your behavior says, dude, you just did something great for your survival. Here's your reward. Keep doing this behavior. Another behavior when we are older, married, protected, maybe when we engage in sexual behavior. Can you tell I work at a lot of private schools that make me say that? Sexual behavior gives an increase in dopamine levels as well by about 150%. And because not only is that good for your survival, but it's good for your species survival. Your limbic system is hardwired to know this, and it increases dopamine levels. Smiling, face to face, eye contact, all of those increase dopamine levels, exercise, all those things do too, because they're all good for your survival. But drugs of abuse increase dopamine levels way too high. Snorting a line of cocaine gives you about a 350% increase in dopamine. Snorting a line of methamphetamine gives you an 1100% increase in dopamine. Now, today we're talking about cannabis, and it's very hard to study how much dopamine increases cannabis because there are so many different types and so many strains. The same is true about alcohol. There's so many different proofs and levels of alcohol. So we have estimates that alcohol is between 150 up to 250, 275. We now have some estimates today that cannabis increases dopamine levels between 125 up to 350, which is the same percentage of cocaine. It used to not be like that, but we see it genetically modified and engineered to the point where it is extremely dopamine spiking today, much more than it used to be. Now, here's what we need to make sure we remember is that our brain has a hedonic threshold. That's just our pleasure threshold. It's how much dopamine we could spike at any given moment. In one day, our dopamine levels go up and down multiple times a day just to let us know you need to go do something good for your survival. You're hungry, you go eat. Maybe you get lonely, you get bored, you go connect with your family. It's just your body doing what it needs to do to survive. So it goes up and down all day. But when we spike our dopamine levels above this black line, our hedonic threshold, a couple things happen. So let me take you inside of the brain, and we can take a look at the limbic system. There it is. And the neurotransmitter dopamine, as it's coming across the synapse of a neuron, there's a beautiful dendrite right there. The signal goes down and it says, oh, produce more dopamine. But when we use a drug that exhausts all the dopamine in our system, we can't feel the same reward that we did for a few hours, maybe days, and sometimes even weeks afterward. So I'll play that one more time so you can see what's happening. The across the synapse, dopamine is coming across, binding to the little teeny tiny receptor sites on the dendrite. The signal goes down the cell that says, okay, keep repeating this process until we feel satisfied what we've done, what we need to do to survive. But substances of abuse deplete the system of too much dopamine, and then we can't make the same amount for days, hours, or weeks after, and we feel pretty bummed out and moody. And that's why we have that saying, as high a drug will take you, it can take you equally as low. Now, the good news about that is your brain will heal from that. It'll generate, synthesize more dopamine, store it, get you ready for the next time that you need it. But the second structural change we can't heal from. So let me show you a long spindly dendrite with a bunch of little receptor sites on it. When we expose our brain to too much dopamine, what we see is more and more receptor sites start to grow. We're actually literally growing more brain structure. So this may happen quickly as in things like with meth or heroin, it might happen much more slowly over years with alcohol, or potentially years with cannabis. I used to see that it would take people literally 5 to 10 years of using cannabis before they became addicted. But now we're seeing it happen within months of the first use because it's so much more potent, which causes the brain to start changing. We're learning. These dendrites are all about learning, and they're like, dude, the more dopamine in my brain means I have to make more receptor sites to handle that. I have to grow more dendrites that go into the reward pathway to help me remember this is something that's like really good for my survival, like way better than food or sex. So I need to remember it. I need to attach to it. I need to grow more receptor sites for it. And this is what you're literally looking at, is a simulated tolerance. More and more and more brain structure means you crave it more and more and more when your brain runs out of it. So thus we have the symptoms of tolerance, withdrawal, and craving, which are the biological symptoms that go right along with your brain growing too much structure for dopamine. Okay, so now let's talk a little bit about genetics. We know in every cell in our body, we have this beautiful double helix, right? Our DNA stores about 30,000 genes, and about 7% of those, about 2,200 of them, are related to mental health, impulse control, and substance use disorder. So genes really tell your body how much neurotransmitter to make. Like, we have some genes that tell our body, like, okay, you're going to have green eyes, Crystal. That gene expressed itself once and it's done. I have genes that tell my pancreas how much insulin to make, right? So that's just my body giving myself instructions. We have some genes that work with the environment. Like if I'm in a lot of stress, then my genes will make more cortisol, which will dampen my dopamine. I can't be walking around calm and happy. I have to actually get busy and get that stressor out of my life. So we have some genes that work together that way. Now, I have about 1,100 of these 2,200 genes that predispose me to addiction. And they're all basically, in my case, all about dopamine. So I have genes that tell my body to make less dopamine than other people do. And thank you to all my relatives on both sides for passing those genes of addiction down to me. But other people have different genes that tell their body to make less serotonin, or maybe less GABA, or whatever the genetic instruction is. And that leaves us feeling a little uncomfortable in our own skin, or seeking out a novelty in different places, or seeking out comfort in other places rather than healthier places. And so that increases our chances of actually trying substances, but it also increases our chances of getting addicted to substances, because I don't make enough dopamine. But when I drink or use drugs, it increases my chances, but it also lowers my threshold for getting addicted and making those structural changes sooner. Okay, so we talked about the brain and how it develops. We talked about how the limbic system gets hijacked because of that process of reward, the attachment that our brain gets addicted by way of the limbic system first getting trapped and then sending a message to the frontal lobes that says attached. And this is one of the reasons why we get so attached to our drug of choice, or all of the accoutrement that come with doing our drug of choice, paraphernalia. Now we have an addicted limbic system, but let's deep dive into what it does to the frontal lobes. So this is a functional MRI looking from the top down into the brain, taken 1 second apart. The person on the top is completely sober. This is what a healthy brain looks like. Everything is on. The color indicates brain activity. So what you're seeing at the top there, you can see in the red, that beautiful frontal lobe right up there at the top, but the limbic system is lit up. The temporal lobes are all on and working together. All parts of the brain are working together. Now, the person at the bottom has a cocaine issue, and ingested cocaine is a part of this study. Now, what you'll notice is that his frontal lobe is down regulating. It is moving all the electrical activity into the limbic system to keep that person up and around and alive, but he's also high and intoxicated. This is what our brain looks like when we are high or intoxicated. Now, this is also explains why we do really dumb things when we are high or intoxicated, right? Because our frontal lobe is off, the part that does impulse control and empathy and all of those really amazing things. Wow, it's just really off. And so, if somebody is using substances on a very regular basis, they're not using that part of the brain. The scary, scary thing here, though, is what if they are in between the ages of birth, let's say birth, to 25? If the frontal lobe is down regulated, it doesn't get to grow the way it should. We call that arrested development. The fancy term is hypofrontality. And this can happen because of pleasure, but also can happen because of fear. So, what we have is a frontal lobe that is not actually on and functioning the way it should. So, all of these skills are not present and available to the adult, and they're not growing as they should to the child. So, if somebody starts using here at age 12 and they don't stop until 20, their frontal lobe will not look like that beautiful 20-year-old frontal lobe. It may look like somewhere in between 12 and 20. And that is really scary because once they hit the age of 25, their frontal lobe executive functioning skills peak at that time. Use it or lose it, right? Remember, processing speed, thinking speed start to grow down. The good news is we can grow dendrites for the rest of our lives, but it just takes longer after the age of 25. So if we can help somebody get into recovery after 25 and they go to recovery meetings and they get a therapist and a sponsor and they start working all the steps, they get to grow those dendrites that they should have grown when they were younger and grow those executive functioning skills. It just takes longer. Okay, so if we turn our attention specifically to marijuana, I just want you guys to know I've got brain study pictures of all kinds of behaviors, substances, and they all show the same thing. The frontal lobe is literally off, downregulated, and the rest of the brain limbic system is lit up due to intoxication. This is a really cool brain study borrowed from the Amen Clinic. It is a SPECT scan, and it shows us what brain connectivity looks like in a healthy, normal brain. Normal meaning no substances. If all your dendrites are connecting, you're going to see a nice smooth surface. These two gentlemen, 16 and 18-year-olds, had a substance use issue. They smoked marijuana. So this is before vaping marijuana became popular. So they had decreased areas in their brain due to cannabis use. Now, a lot of people are like, ooh, those are holes. They're not holes in the brain. They're just areas that haven't developed and connected yet. So scary to see. Specifically, you can see right there at the top, what should be the prefrontal cortex is just not developing as it should. Now, their earlier executive functioning skills are developing, right? So, but the later skills are not. Now, another example of what that looks like is over, slices of the brain. This is what a person who looks like who does not smoke or use marijuana, what their brain activity looks like compared to somebody who abuses marijuana. And really what you're seeing, like the third one is probably the most obvious. There's the frontal lobe right up there. Nice red. We want to see a lot of activity in that part of the brain, but we see decreased activity in the prefrontal cortex in people who use substances, this one specifically marijuana. So that frontal lobe, those executive functioning skills are either off or not growing. Now, I love this study because it shows what it looks like to heal. Now, please know this is not marijuana. This is back to that cocaine abuser, but it looks very similar with all kinds of substances of abuse. And so if we take a look at that middle one, there's a cocaine abuser 10 days sober, which is really, really wild. There, the bottom one is 100 days sober. So you can see that frontal lobe is just starting to turn back on and heal. Now, what's really disturbing to me as a clinician is the half-life. So half-life, how long it stays in your system. Alcohol is about, 24 to 48 hours. So 2 to 3 days after drinking, your brain may look like that middle or that third one. And then it can move back to a normal functioning after 3 or 4 days. Marijuana stays in your system longer. If you are a regular user, it can be 6 weeks before it's out of your system. If you just got high one night, it could take 1 to 2 weeks for that to get out of your system. So we don't have pictures of the brain every single day for days after somebody stops using, but we can conjecture from studies like this that it may take days or potentially weeks for that frontal lobe to turn back on. So I always ask teenagers, like if you go out drinking on Friday and Saturday night and you do that every single week, your brain is not completely back on until Monday or Tuesday. So we could take, 3 days of frontal lobe growth that is being arrested times 4, and you're losing roughly about 12 days of normal frontal lobe development every month. And some kids say to me, "Yeah, okay, that's fine. I have fun. I'm good. I'll be fine as an adult." That's their prerogative or their parents. But if it's marijuana and they use 1 or 2 times per month, they're looking at arrested development the whole entire time. So in as far as an assault on neurodevelopment, I think marijuana is one of the worst offenders because of that. Okay, now let's talk about coping, because we see and hear so many people say, marijuana saved my life. I don't know what I would do without it. Now, please hear me. If you have a cancer, if you have glaucoma, if you are in pain, if you have a terminal illness, if you have a seizure disorder that causes daily seizures, absolutely, there are cannabis medications that can help you not feel that pain, that can help you mitigate the seizures and reduce inflammation and swelling. But no cannabis actually treats or cures anything. And we'll talk about how it actually affects us here. So we know that marijuana affects our cannabinoid system. So our body makes neurotransmitters in the endocannabinoid system that help us regulate all of these symptoms. And so, what anandamides do in the endocannabinoid system is they regulate our body and make us feel better when we have pain and inflammation, immunities to illnesses. They help us regulate our appetite, our metabolism. Our gastrointestinal tract functions are regulated by cannabinoids, memory, movement, and emotions. So remember our beautiful limbic system, right? Here's where a lot of this takes place as well. And our cannabinoid system in the brain. And so the neurotransmitter that we're talking about here is anandamide. And so here are a couple of examples in 3D form of what 2 anandamide molecules look like. And so you can tell that THC, tetrahydrocannabinol, actually mimic the look and feel of anandamide. So your body's natural endocannabinoids that regulate all those systems, they don't actually make you feel pleasure like dopamine does, but they do have a calming and soothing effect, right? So THC actually binds to the same receptor sites so much faster and more powerful. So now you do feel a huge calming a feeling when you use THC. It's binding to the exact same receptor sites, but so much faster. Part of the problem is your body's like, oh, I don't need to make as many of these because the THC is binding to the sites. So your body stops synthesizing them. Now, remember, endocannabinoids are so important to regulate all of these systems in your body. But THC mimics them, and thus you're now dependent upon THC to regulate all those things in your system. And you're much more used to the intense feeling that you get from THC than you did from your own anandamides. Okay, now let's talk about what do we do? So that's why I created Know Your Neuro, because I want kids to grow their own skills. So when you read things like advertisements online, when you Google the harmful effects of marijuana, you come up with thousands of websites that look like this, that make it seem normal, that make it seem okay. They don't really tell you about all these negative effects and discuss addiction so much, because they are in it to make a whole lot of money, which is why we have all these sites, including yours, that are states, including yours, that have legalized it. Please know there are about 10, 11 lobbyists that work for the alcohol industry for every politician in our country. There are 13 lobbyists that work for the cannabis industry that lobby our politicians and feed them really bad information. So we actually just had a law in Texas that would ban hemp-derived THC products. And even though our governor said he would sign it, we know that some lobbyists got in touch with them and some business owners got in touch with them. And so he vetoed it, and it is now in special session. So we're hoping that that special session will yield good things. But part of the problem is when we have that many states legalizing it, it makes kids think, it makes adults think that it's really not very harmful. And as you can see from this slide, I've actually just updated it to be to 2022, but you can see that as perceived harm goes down, marijuana use goes up. And so we're seeing that the perception of harm has been going down and down and down because, of course, everybody in the the world is saying, "Oh, this is just marijuana; it's just weed." But unfortunately, this is not being reported of how it's being genetically modified. And a lot of times when people think about medicine, they're thinking about the CBD part of weed, which is the actual non-addictive pain treatment, pain and inflammation treatment part of it. It's just the different molecules in marijuana. So we think about all the different molecules that are in weed or the actual plant, we see that there's a lot of different CBD and THC molecules. This is actually an advertisement from a marijuana company that shows all the different things CBD can be used for, which is literally true. But when we take out the CBD from the plant, we have to use a whole lot of it to get these effects, which can actually hurt the liver because processing that much CBD out of our body is pretty difficult. So I got this advertisement in my email that smoking versus vaping marijuana, you shouldn't smoke it. You should definitely vape it. It's better for you, this advertisement says. You guys probably live in a state where you're seeing this kind of advertising everywhere, but it's actually absolutely not based in science. This is based upon a marketing company that wants to sell you a vaporizer that is pre-loaded with marijuana. And so it's interesting because you can see what this advertisement is saying, that, it helps reduce feelings of anxiety. And there's a little asterisk, but I could never find what the asterisk went with. It says that it reverses damage caused by alcohol. Again, a little asterisk. Neither one of those are actually true. It actually increases anxiety, paranoia. It does not reverse damage of alcohol in any way, shape, or form. It is true that you didn't need a prescription for this in that state, but it's also not true that it's legal in all 50 states. So it's really, really interesting what we're seeing. This is a chart that I have in my book that looks at how the industry that grows and synthesizes marijuana has been dealing with CBD. So CBD amounts are actually in orange, and you can see they're going down. I've since updated this chart to go, and it's almost minuscule as the THC amounts are going up and up and up. I mean, this is only back in 2015 when the average amount of THC was about 12%. Today in Texas, Texas, we're seeing the average amount of THC in vaping marijuana products is between 56 and 99% THC. So the amount of CBD is being genetically modified out of the plant or not added as a synthetic addition because it modulates THC. And they don't want that to be modulated. They want the full effect. We also see that when states advertise and legalize it, that they actually put out really incorrect numbers. This was something that the Yes Prop on 91 in Colorado said that teen use, traffic fatalities, and arrests are all down, that no change in adult use, and that tax revenues sky high. What they don't tell you that you guys might have realized in your state is teen use and adult use are all going up. Traffic fatalities are going up. Arrests and violence are going up. And the tax revenue brought in by medical and recreational marijuana is not covering the deleterious effects that it's having on public health and our legal system. So this is a chart that I have in my parent guide. We've since updated it for the teen guide that has the past 85 years of peer-reviewed solid journal article research that has been replicated over time to show what the short and long-term effects of using marijuana are. Now, please know, true recreational substance use, which might be 2 to 3, 4 times a year, that is not represented here. What is represented is the number of people who use marijuana on a moderate to severe basis. That means either a monthly or daily basis. And this is what it causes. So it's very important to let people know that medicine is definitely not a term that is used by the medical community. It's really used by marketing community. So we have to teach kids that we don't go to places like this to get our medicine because it is not a pharmacy, and neither is this. Like, these are not places to go to get dose consistent, well-regulated medicinal products to treat things like pain or anxiety or anything else. These are smoke shops that want to sell you stuff that is unregulated and untested in many ways. I'm not saying all of that is, but what we're seeing is that things like cannabis and kratom and a lot of the things are really untested and having deleterious effects on our kids and adults' mental health. So there are medicines that have been approved by the FDA that are based upon CBD and cannabis products. It might be difficult to get these, but if you do have a seizure disorder or any of the different recommended illnesses that you can get these prescriptions for, you do have to go through an FDA process and approval. But I have clients who actually have these medicines that have received them and gone through that product. These are consistent, dose dependent. You get the same amount of THC every single time that you take it. You get the same amount of CBT for every single pill. These are highly quality regulated products. So here's what we want to do. We want to teach kids this information, and we want to teach them to protect their brain development and to feel their feelings. When we use products like cannabis, we don't feel anymore. We have a heightened high dopamine response, and it numbs our ability to actually feel feelings. So we need to make sure that we teach kids how to be emotionally literate and help them navigate tough family systems where we don't talk and don't feel and don't deal. So we need to teach our kids that if they're having dysfunction in their family, to reach out to the systems that are around them for help and assistance to learn how to deal with what's going on. So in my parent guide, I have specifically a media talk that I teach parents how to talk to kids about the media that glamorizes these things. I also have the medicine talk there too. So we want to make sure that we teach kids what a medicine is and what a medicine isn't. They're not going to find a medicine at these, the gas station. We need to make sure we help them find what they need in regulated and safe ways. Also, on the website knowyourneuro.org is a free activity and a PowerPoint presentation for schools to create a family code and to get together and to learn how to do this as a family. This presentation, I have some references here that I have shared with Courtney so she can send those to you. But please just go to knowyourneuro.org and you'll find all the videos about brain development, cannabis, and all the other high risk topics that are there. So free resource for parents, for clinicians, social workers, everybody out there. And please also know that all the sales of all the books that I write go toward the nonprofit knowyourneuro.org to keep that website up and running and free to use for everyone. So the Neuro Whereabouts Guide is in English and in Spanish. The website is actually going through a new change where we're going to have 8 different languages. Sorry, my bad. 6 different languages for the videos and the handouts that can be used in schools and in treatment centers. Okay. I'm sorry that I have spoken so fast, but I wanted to make sure to get everything out in enough time for you guys to have questions. And so I see hands that are up, but I think somebody is monitoring questions for me. Is that correct? Or do I need to just go to the
Yes.
Q&A?
No, you're correct. I'll be helping you out with the Q&A today. Thank you so much for that wonderful presentation, Dr. Collier. So we are going to open it up to questions now, and we ask that all questions are submitted through the Q&A function, which can be found at the bottom of your screen. And just as a quick reminder, the webinar recording and presentation slides will be available on our website, washtenaw.org/marijuana, in the coming weeks. So now let's jump into some questions that people have. There was a question about how you got your DNA results that told you about your specific genes and related to dopamine.
Well, here's sad news is the company that I used went under during COVID. So I've been really looking for a company out there. I've approached 2 different companies who do genetic testing, but nobody will do the same genetic test for the price that I got mine for. It's anywhere from $2,000 to $4,000 to get genetic testing today. So if anybody out there knows a good company who might be willing to do a very specific sliver of genetic testing, so we can get you your what's called the RDS score, reward deficiency syndrome score, please let me know. And if I find someone who does, or if I know that somebody opens up another business for doing that, I will announce it on my newsletter. So please go to Know Your Neuro and get on my newsletter. I won't blast you very often, but I'll make sure you get the news that you want.
Thank you. We also have a question asking, with the new, more potent doses, are there good signs of recovery for cannabis use in youth 12 to 18, and also after they're adults?
Well, here is what I'm seeing, and this is just anecdotal. I haven't seen it in the latest literature because, as you know, it takes 2 to 5 years for literature to be published. But here's what I'm seeing. My clients who start using at 14, 15 are addicted by 16. They're having hyperemesis, they're having psychosis, and it's changing their brain. It is changing their brain and their body. They've become so addicted. They're having such negative psychological effects. And I'm seeing a percentage of those not getting better. And I just saw an article last year about schizophrenia, that about a third of the kids who are having cannabis-induced psychosis, that it is actually not getting better, but it's moving them into full-blown schizophrenia. I've got parents who don't know what to do with adult children because they have to institutionalize them because of what's happened to their brain and body from a very short period of time of using. So this is looking grave to me as a therapist and clinician, I'm not seeing the best recovery rates. And not to mention insurance companies, many of them are not paying for cannabis addiction. Like you have to literally put a different addiction before that addiction on their, medical forms for any reimbursement to occur. I'm also not seeing a whole lot of Marijuana Anonymous meetings out there in the world that are filled with really strong long-term recovery. So right now, it's not looking great for young people.
All right, thank you for that answer. There are also a couple of genetic testing companies that people have put in the chat and the Q&A. So it looks like GeneSight is one, and GenoMind. So maybe things to look into.
Oh, wonderful. GeneSight and GenoMind. Okay, that sounds great. Thank you.
Okay, and we have a question as well asking if you have any citations for the financial claims you made concerning the deleterious effects of THC legalization.
The financial claims that I made. I'm not sure, but what I would encourage you to do is to please send me an email. My email address is right there, Crystal at Dr. Crystal Collier. I pride myself on reading journal articles, and so I've done lit reviews since they started doing research on cannabis. So please feel free to reach out and I'll get connected. And if you have my parent guide, there are oodles of resources and references there. But I don't know what you mean about the financial claims. So you'll have to give me more clarification.
We also had a question asking if you know if Medicaid covers the cost of medications that you mentioned, like Marinol.
Oh, I do not know that answer. I just don't have enough client. But I actually can ask a client that I have who is on Marinol if it does, but I'm not sure.
Thank you. Another question is, who do you consider to be at-risk youth, and how do you reach them with your education and trainings?
Sure. Well, it's not me considering them. We have, 85 years of prevention science on risk factors and protective factors. And so if you, there's literally tests that you could checklists that you can figure out who is at risk and who has more protective factors. So I would encourage you to look at those lists, and some of them are very common sense. Some of them, they're not as much. But I would look in risk and protective factor research for that answer.
Perfect, thank you. And I think we have time for just one more question before we close things out. So what is one of the best coping skills that you would share for teens who are dealing with marijuana cravings?
Well, for marijuana cravings, I mean, they need addiction treatment. Like if you're having cravings for a substance, that means you have moved into the abuse or the dependent category. These are physical symptoms. And so there are so many different ways to treat the physical symptoms of it. There are other medications that can block receptor sites. There are specific behavioral coping mechanisms. I would recommend connecting them to a really good psychiatrist and a clinician who specializes in addiction to tailor the coping skills directly for them. I just saw a question too that dose-specific gummies from dispensaries. I just want you guys to know that a dose in a gummy is usually 1 foot, the foot of a gummy. Like who actually eats one gummy bear foot? So be very, very weary of a dispensary selling a dose-specific amount of marijuana. I would want that to be independently verified and tested, and I would want to know how much of a gummy is, in the dose. So be aware.
It's very good to know. Okay, well, thank you so much, everyone, for attending today's webinar. We hope that you found it both informative and interesting. We would greatly appreciate your feedback so that we can continue to improve our future webinar offerings. Please use the link in the chat or the QR code that will appear on the slide to complete our feedback survey. And as a reminder, this live webinar has been approved for 1 social work continuing education clock hour, 1 specific McBAP credit hour, 1 Mishwa credit hour, 1 CHES credit hour, and 1 credit hour of CME. If you're requesting any of these continuing education credits, you must fill out the evaluation form with your name and email address. And again, that is in the chat or scanning the QR code. For the next presentation in our series, Dr. Brittany Taylor will be presenting Cannabis and Primary Care, a brief guide to cannabis for the healthcare provider, tomorrow at noon Eastern Time. If you have not yet registered for the other webinars in our series, you can do this by using the link in the chat or visiting washtenaw.org/marijuana. And we hope to see you at the next webinar. Thank you so much for your participation.
Thank you, guys. And I really appreciate and honored to be here. If I didn't get to your question, please feel free to send that information or a question to me.
Thank you so much for presenting, Dr. Collier.
You got it.